A lot of times after we give birth, moms were kind of, pushed aside. We're focused more on our children. Charlie was born February 1st of this year, and she's 7 months old. It seems like right after your 6-week appointment, you're kind of on your own. I found out about the eMCAP program a few days after I gave birth to Charlie. Someone came into my hospital room and explained the program to me. Within a few days, my first appointment was set up. This program, they make sure they take care of you and make sure you're doing well, both physically and mentally, throughout the first year after you give birth.
But when you examine maternal mortality rates in our own state, the threats of death to women actually are higher in the postpartum or afterbirth period and include things like mental illness, substance use, and cardiovascular disease.
We've experienced previously that many of these women get lost to follow-up outside of their delivery and consequently are sicker in their subsequent pregnancy. So postpartum care is absolutely important and critical.
In 2019, the Community Health Needs Assessment identified significant health disparity in southern Dallas County. The eMCAP program is the Extending Maternal Care After Pregnancy program. And this program is designed to evaluate, measure, understand, and provide care for women living in southern Dallas County.
For those first 6 weeks, you've got some kind of medical coverage that you go to your routine postpartum visit, but after that, there's no more medical care that's covered. This is definitely a resource for them to be able to get extended maternal care for that full year that pays solely attention to mom.
Now with Charlie, the healthcare workers make sure that my mental health is doing well and that I'm doing well physically as far as my blood pressure and heart rate and just how I'm feeling overall generally.
The eMCAP mobile healthcare unit is available every Friday down in South Dallas to postpartum women. The mobile unit provides comprehensive care for some of the more chronic medical conditions.
As soon as you enter into the mobile bus, you're greeted by the person who checks you in. You feel very welcome and like you're in the right place. It doesn't feel like a typical doctor's office. It's very inviting and you feel important. And my healthcare providers and I have started like a friendship. We know each other by name. They take the time to address any issues that you have. And even if you're not feeling well or if you can't make it in person, they have telehealth where they'll give you a call and you can still talk to them about any issues that you have.
We've identified that women with higher needs, for example, not being able to pay their bills, to have higher rates of postpartum depression. For every patient that's enrolled in the program, they receive material support like diapers and wipes that are necessary for the care of their infant. We have individual examples of patients involved in this program receiving support. Another example is a patient that was identified to have hearing deficits, and she was concerned she wouldn't be able to hear her baby cry after birth. And the program was able to provide her with hearing aids and support to be able to reassure her that she would be able to hear her infant when taken home. To be able to give impact at that individual level is critical.
We've enrolled over 1,000 patients in the eMCAP program, and we have just under 100 that we see in the mobile unit. Making sure that we have adequate funding to provide comprehensive care, again, just beyond the medical needs of our patients is critical if we really want to address the issues of postpartum morbidity and mortality in Texas. Postpartum care goes beyond just 40 days.
So it's very important now that mothers know that there are resources for them if they're struggling. The mortality rate after birth is pretty high. So having this program here and readily available and close to our neighborhoods is very important. I hope that other women see this and decide to sign up for the program when they're in the hospital so that they can receive the care that I have.